Hello, and welcome to my final presentation for the PSY307 course. My presentation and paper were on mood disorders and suicide prevention. A challenge that faces many professionals in the mental health care field is managing suicide risk among individuals with a mood disorder. The term mood disorder refers to a group of different disorders that involve the severe and persisting disturbances in emotional regulation, ranging from extreme happiness or mania to severe depression. Due to this broad and unstable spectrum of emotions, effectively treating symptoms can be difficult. The number one reason for noncompliance among individuals with mood disorders is anosognosia, or their lack of awareness of their illness. Other reasons for noncompliance include denial, stigma concerns, problems with side effects, and substance abuse. The consequences of noncompliance can be dangerous, especially during periods of depression when the risk of suicide increases. More than 80% of people who kill themselves suffer from a psychological disorder, usually mood, substance use, or impulse control disorders. Current research provides helpful insight on this topic, which aims to improve mental health care standards. Findings have helped identify who is at risk, what indicators professionals should look for, and the effectiveness of the current methods of treatment. Mia is a 21-year-old female who was diagnosed with bipolar II disorder in her late teens. Her mother urged her to seek therapy because she has been depressed over the last few weeks. Her symptoms began with conflict between mother and daughter regarding future life plans. Her mother expects her to either attend college or go to work. Mia has not pursued either avenue. Instead, she now sleeps most of the time, has been decreasing her interactions with friends and family, and spends most of her time alone in her bedroom at her mother's house. After the initial interview with Mia, she reported feeling worthless, having nothing to offer in a job or at college. She stated that when she is happy, she does not really drink, but lately she has been drinking every night to help her fall asleep. During the intake interview, Mia explained that her father committed suicide when she was 4 years old, and she understands why he made that choice. Mia also has a history of impulsivity. Recently, she drove out to an out-of-state college to visit an ex-boyfriend who she missed. He did not know she was coming, and they hadn't spoken to each other in over 6 months. Mia's treatment plan includes a combination of cognitive behavioral therapy, medication, and social support. It is recommended that she attend a minimum of 10 therapy sessions, occurring consistently every week. She will also be prescribed lithium to help reduce suicidal ideation. Social support via cooperation from family and friends will be imperative. A safety plan will also be put into place to prevent suicide attempts or completion. Finally, management therapy will be completed as needed once symptoms are under control. Studies have revealed the trends that exist in relation to suicide-related outcomes within certain age groups, time periods, and birth cohorts. According to this information, a female in her early 20s who has a history of a major affective disorder such as bipolar disorder, who has also experienced a major depressive episode in the last 12 months, is at the highest risk of completing a suicide attempt. It was determined that while indicators have increased across all genders, the increases were largest amongst women, with a 78% increase among 20 to 21-year-olds. The risk also significantly increases by an alarming 20 times greater than that of the general population if the individual has a bipolar mood disorder. Information such as this can equip mental health care professionals with the knowledge of who carries the highest risk in an effort to prevent an unnecessary death. Along with identifying who is at risk, research has also helped to pinpoint the specific indicators of a suicidal individual. The more obvious short-term risk factors include suicidal ideation and a recent suicide attempt. After further investigation, factors also seem to include impulsivity, aggression, and hopelessness as powerful risk factors related to the increased completion of suicide. Another strong indicator is having had manifested psychosis at some stage in their bipolar disorder. This was found to be true in 63% of completed suicide cases. Having the ability to recognize the clinical and personality factors associated with suicide risks among individuals with major affective disorders is crucial in suicide prevention efforts. The final component of this research in managing suicide risk among individuals with mood disorders is the evaluation of the effectiveness of current methods of treatment. Medication has proven to be an effective measure in the management of mood disorders and the prevention of suicide. It was determined that mood stabilizer use was the only protective factor for suicide risk. In fact, lithium has been proven to be the most effective anti-suicide intervention, with statistics showing that individuals are 70% less likely to commit suicide or self-harm while taking this medication. Cognitive therapy is also an effective method of treatment. In fact, one study demonstrated that 10 sessions of cognitive therapy for recent suicide attempters cuts the risk of additional attempts by 50% over the next 18 months. However, there are areas where treatment efforts need improvement. In posthumous evaluations of bipolar suicide cases, it was found that in 60% of those cases, overall treatment of the patient was found to be inadequate in the month leading up to the suicide. The main factors that were cited to be the cause of the failing of these therapeutic interventions were inadequate pharmacotherapy and inadequate follow-up. This evaluative research generates disappointment in finding that the mental health care system has failed many patients, but it is important to learn from this information in order to make improvements for current and future patients. The current literature on managing suicide risk among individuals with mood disorders has enriched the understanding of who is at risk and what indicators mental health care professionals should be aware of. It also has highlighted the strengths of treatment as well as put a spotlight on the areas that need improvement. Expanding upon the current information will only benefit the mental health care field, as well as the individuals who need the guidance and support from the professionals within that field.